gonna start presenting very quickly an overview of the TriNetX. Whoops, I don't know. Okay, about the TriNetX network and what we're doing, and then, well, Joan will be presenting basically his experience within Sant Joan de Déu Children's Hospital and what they're doing with trading the data to well to improve basically the managing the patients. So regarding the network in TriNetX, so I would like to mention that we are a federated research network. Whoops. We are a federated research network that is counting with, well, with more than 200 institutions, and our goal is basically to enhance research studies and clinical trials, connecting the different healthcare institutions between them, and also connecting them with some of the sponsors that we are also working with to deliver more trials and to deliver more clinical research to those institutions. So basically, that's what we do. In our federated network, basically, what we are doing is to standardize the data in the same way, with the same data models, with the same data terminologies in all the healthcare institutions that we work with. This allows, of course, to compare and to avoid biases when we are doing clinical research, and it enables the federation between these clinical institutions. And, well, this then is connected with different promoters of clinical research, for instance, pharma companies or CROs, that can share to all the network, well, new opportunities of studies and new opportunities of research. So, well, all of this is done through privacy and with privacy by design. And basically, well, we're certified in ISO 27001, and we try to follow all the standards and local regulations to operate this. We have a headquarter in Boston, another in Ghent. This is in Belgium. This is the European headquarters. And, well, basically, what we are trying to do, of course, is to operate in this federated model, complying with, mainly here in Europe, with GDPR, local legislation regarding data privacy, and, of course, with the security standards of data managing that can be applicable. In this sense, what we deploy in each hospital where we work with and in each healthcare institution is a platform. It's a research platform that basically enables the physicians and the researchers within the institution to build cohorts, generate analytics, and generate real-world evidence. It enables you to query some data to get anonymized results, and to get statistical analysis already included within the platform and without having to go to additional programs like SPSS, SAS, or R or Python in the low level. But you can, in a high-level way, and in a no-code way, to generate some cohorts and generate this analysis. Of course, this has some limitations, and we work with some institutions into also providing value with patient-level data sets and so on. But this always taking into account the privacy points, and well, of course, it's not always easy to work with patient-level data. And yeah, in terms of numbers, the publications that we have increased exponentially. We have received more than 24,000 trial opportunities through the platform to the different organizations that are part of it. And we have a high number of users using now the platform, mainly in the data science unit, in the clinical trial unit, and also as the different physicians and the different principal investigators of the organizations. Here are some numbers regarding the pathologies that we are using. We are pathology agnostic, and we basically are trying to covering as many pathologies as we can. We have had a late focus on endocrinology, on dermatology and rheumatology, but always with a high focus on oncology and in general medicine. And in particular, both in the network in the US and in the European Union, we have a high focus with the pediatric care and because it's very difficult to do clinical research within the pediatric institutions, and this is one of our main focus to keep improving on that. So to finish my presentation, this is basically where we want to keep improving with using AI to keep developing our tools. And I'm going to finish with a very short video of how we're trying to enable an easier way to make the translation from a protocol, from a clinical protocol, to some standardized terminologies and some standardized queries that can be accessible, in this case, through the platform, but anyways, transform it to standard ontologies and standard terminologies to create cohorts in an automated way and to be able to then launch it into a database directly. So, well, this is the short video. This is a query where we could have some free text, and this free text could be converted directly into a query in the platform already with the inclusion and exclusion criteria and with the terminologies that are already supported in the platform, which are ICD codes, LOINC for labs, RX norm or ATC codes for medications, and well, also we have ICD PCS for procedures, and well, we have SNOMED as well. And the idea is that giving a text to the platform, it can translate it to you into an already queryable design, so you can already execute it in the platform and run your analysis without having to develop the cohort and build the cohort yourself. So, well, this is basically another example. And as well, if you're having a prompt already generated, it could also do for you the structure of a protocol with exclusion and exclusion criteria, the patient eligibility, etc. So, well, this is just something that I wanted to show you regarding new features that we are developing. But now I will give the mic to Joan so he can show you what they are doing at Sant Joan de Déu.
Thank you. Kind of impressive, this AI tools. I will, well, I'm Joan. I am actually the lead data scientist in the Digital Strategy and Data Office in Sant Joan de Déu. And today I'm trying to give you a hint of who we are and what we are doing in the office. So just to a little bit of a recap of what is Hospital Sant Joan de Déu. Is a maternal and children hospital. Is affiliated to a university in Barcelona. We are private and not profit, but we have a very strong collaboration with the public health system. 90% of our activity is from there. So we have more than 300 beds. We have more than 3,000 professionals, and we treat more than 300,000 patients a year. Actually, our mission was to cure and care for vulnerable people in a humanistic and to create a fair society, and we treat all the people that comes to the hospital. As you may see here, there are people coming from different countries. This changes between years, depending. We had a lot more patients from the southeast. Now it comes primarily from Europe and South America, because we are a hospital that actually tries to treat or to manage patients with rare diseases. So there was a talk in the main stage about this. So I will not extend too much on this, but yeah, rare diseases are pretty uncommon, are difficult to treat and to manage, but there are a lot of rare diseases. So there are more than 7,000 rare diseases that are already diagnosed. That implies like 3 million patients in Spain and also in France, as I heard some minutes ago. And actually, they are quite difficult to manage. Here in the hospital, rare diseases are 12% of patients, but they generate about 0.5% of the activity and the budget on the hospital. So difficult to treat, difficult to manage, and also difficult to diagnose. Most of these patients are like last like 5 years to be diagnosed. What a change! But yeah, in the hospital, we are building a huge cohort of rare diseases. We treat more than 1,000 different diagnoses, and we are almost in the 30,000 patients in our census now in 2024, and well, as you may imagine, we are the big center of rare diseases in Spain by a large margin and growing. So yeah, one thing that well, different thing happens when you think on these patients. I will not go on all of them, but yeah, they are chronic. We have to diagnose them with multiple in an holistic view, so using different sources of data, and yeah, we have kind of an integrated care. So here I will pinpoint just two of these steps on the pyramid. The first is the liquid hospital. So we are an hospital that believes since 15 or 20 years ago that actually patients are better at home, mostly kids, and we are making a huge effort to keep them at home and treat them there. So we have 45 professionals going every day to all their homes to treat them there, to help them there. We have also patients in the hospital, of course, but our idea is to increase this liquid hospital philosophy and keep them as much as we can at the home and monitorize them there. Also, as you imagine, we have to keep track of how they are. So we have different facilities like the contact center or the e-care that cares to call them, to have teleconferences and see how they are, and trying to communicate with the primary care to give them the best manage. Also internally we have the clinical command center that is actually cares about the external but also the internal patients that are in the hospital, and we manage all the whole cycle of these patients in there, and we try to activate facilities before the patients go there, trying to increase our efficiency on how to treat the patients. Then regarding the data, we already know that data is so much important, so I am not surprising here anybody. And from several years ago, we are trying to treat very careful the data and we build kind of a reactive model. But since the last year, we are trying to develop AI tools, machine learning, whatever, to be like more proactive. And we are trying to go to put these algorithms in production and see that they are actually good for the patients. We go for the patient before they ask us to be treated. So that's the idea. So how we do that, we monitorize them a lot. So with the experience of the liquid hospital, we have lots of data that we are gathering, and we are governing it and put it everything like high quality. Also, we are trying to not to replicate the data, so we are a hospital that tries to have high quality data, and also unique. So we are not replicating. We are kind of virtualizing the data. That's the informatic term. And with this high quality and unique data virtualized, we are building our artificial intelligence pipelines to help to try to be like more prognostic, let's say. Just to center it a little bit more, since this year we are Center of Excellence in AI and Rare Diseases together with La Caixa Foundation. We are building different. We have different workflows, work streams, working on the hospital to not only to develop but also to implement all the solutions that we are developing. So we are. I'm starting from the end on the slide, but we did a great effort to try to understand how to govern these AI models, to see how we deploy them in production, and see how we measure them in the day-to-day work to see if we can actually make a change or not in the patient management. So different going back, so different work streams. The first, we are trying to better integrate data. So we are integrating genomics, transcriptomics data in a multi-omics platform. Also, we are in collaboration with regional and country level to connect this data also with TriNetX, and we are also putting data in different sandbox spaces for third parties to try to validate some of their solutions in our data. Also, we have the idea of the digital twin that is already mentioned before in some talks, that what we are looking for is that patients that come first, when a patient comes to the hospital, we are looking for some patients in our databases that mimics the patient that comes at this point, and see how it goes, right? And finally, LLM stuff, right? We are putting transcription in production, so the doctor-patient conversations are now transcribed and summarized live during the visit, and then the doctor is just accepting the transcription. Hopefully will reduce times in the visit. And we are developing also some chatbots internally to better manage internal documentation and the like. Finally, I cannot end without saying that rare diseases means federated. So we are coordinating a country effort with the health ministry to actually interoperate with 30 different hospitals in Spain. Also, we are in different European initiatives to share this kind of data. And since we have two new facilities, one in the Pediatric Cancer Center that actually is one of the biggest in Europe, and since oncology in pediatrics is a rare disease, we are doing a big effort on this. And finally, for the end of the next year, or 2026, we will have a new whole facility that is the UNICAS Precision Medicine Center that will centralize a lot of the efforts that we are doing right now. And that's more or less all I want to tell you, and happy to take questions if there's time.
Thank you so much.